So I got like I hadn't had any fucking insurance or medical insurance or any of that shit. I bought that stuff probably a year ago. I guess that's how you, like, when you're maturing, you do responsible shit. So like I got medical insurance. People are always like, you know, the car this, or what if your bike gets stolen? Like, I'm insured to the point, like, if they stole that shit, I have replacement value cost on everything. Like, it doesn't matter. Like, somebody stole one of my cars or something, like, I'm gonna get a new one, probably a better one. So I go see the doctor, and hadn't had a physical in 10 years. So I go in there and, like, I feel 43. When we moved to Tennessee, we didn't have steps going up on the loading dock. I'd hop and just jump up there, you know, 7 years ago. When I bought the big truck, you know, almost 10 years ago, it has 37s. I just fucking jump up in it and jump out. Now I find myself stepping on the step and getting down. Like, I feel, every time I, you know, had surgery on something from, you know, breaking it, you know, riding motorcycles or something, the doctors always said, when you get older, you're gonna feel this. And I was always Superman. They're like, it's gonna be 6 months till you ride, and I'm riding fucking 6 weeks later all the time. Well, now I'm fucking 43 and I feel that shit. So I don't go fucking heavy in the gym anymore. We do a lot more body weight stuff. I just have to fucking make my body last another fucking 43 years. So I keep getting all these fucking dudes that show up on the YouTube, and they show up on Facebook over the last couple years, steroids this, steroids that. And I'm like, guys, I'm flattered that you're accusing me of using steroids. So I go get tested, and I'm supposed to be at about 1,000 level for testosterone in my body, and I test out at 350. So I'm going to get hormone replacement therapy. They're going to put 16 100 milligram pellets in my ass, and we asked them, hey, can we videotape that? And she was totally cool. So we're going to shoot a video on that and kind of track a week from now, and then a couple weeks, and we'll track it every week, kind of do a little report on, you know, how I feel and what this has done for me, and just kind of share it with you guys. I know a lot of you dudes are, you know, older. You know, they say at 30, 35, your body starts, you know, you've hit that peak and you're going back down. They talk about sexual prime of a female and sexual prime of males and shit. So we're just going to put that out there. It'll benefit some of you guys. Some of you guys will talk shit, whatever. So that's what we're doing right now.
Alright, so I'm going to clean this spot off. It's just somebody down. And we'll do about cross. And then down just a little bit. That's my gauge on where to pick. I don't just...
Is that just, is it avoiding pressure off like sciatic nerve pain, things like that?
I just go to right there at the crack and go over and down just a little bit.
Yeah.
See, we're doing this video because I'm going to put them in him later today.
Well, you know, it's kind of funny, but Nathan that works in the lab said, I somebody put mine in. So I turn around and we've practiced, and I've showed him that I have to lean around and help him a bit. All right, here's stick and burn. This one is like a wheel, because this is where I'm going to put the...
Yeah, that burns.
That's where I'm going to make the hole. But now these are just to numb where I'm going to shove the pellets down into. And when I mean shove, we got to find spots to put them.
And what are you using for the local?
It's a Red Label lidocaine, 3%. Cool. And I'm making it in a V shape, so that whenever so I'm going to mash it, and it's going to spread that lidocaine around, so we've got all that area to put them, hopefully, and he won't feel it. So we're going to let it numb up.
How many injections you put in? 3?
Yeah, I did the first wheel here, and then I went down to that dot, and then back up, and down to this dot, back up. But I went in the same area 3 times. And that's the same thing we're fixing to do here with your pellets. It's going to make this one hole, but I'm going to go in and out of it. Now, if you want to straighten that leg out, you can if it's bothering you.
Can you feel still?
I know she's touching me. I knew
See how it's blanched out right there?
Yep.
I knew
It
that
should
was
be
going
ready.
in there. Like I felt
We'll
it.
see.
I felt all 3 of them.
Well, yeah, it takes a second.
Well, usually it's really fast acting, but earlier today, one of my patients, we had to wait a little bit. You feel that stick?
No.
Okay. Tell me if you do.
That's awesome.
And you'll feel this give,
Mm-hmm.
and then you'll know you're
Below
in there.
it. Yeah.
So anyway, put this little stick in there. See those little holes.
Mm-hmm.
And the ideal is to just slide this in here. And there's a very fine line where to go. And may have to make my hole bigger, but we'll have to. I start out small. How's that?
I'm okay. My hands are sweating like fucking crazy.
It's just nerves.
Yeah.
So does it make a click every time you're injecting one, or do you know that you're injecting them, or they're so small and time release that like the way they work, they just.
I mean, he's not going to know. It's just going to do it so slow.
Yeah.
Okay. So there should be any more pain, so you should just kind of chill. We're just going to start loading this up and putting them in.
That is so cool.
And it varies. He's getting 16, so I'm going to go in 3 different times. So you can put 6 in at one time on one side, but I won't. I'll just put 4 or 5. And so this is the blunt one.
Mm-hmm. And
I'm
it's just like a plunger.
Yeah, I'm just going to shove them and say they're here, so they're going to be pushed way down there.
Gotcha.
So, like when we're done, I'll talk about the site. The site, I'm usually not that much worried about because it should heal up just fine.
Right.
Somebody that's never had them before might get alarmed because you might get heat down here. Just because I just put in 16 foreign objects into your
Right.
And that's just.
Your body's trying to.
Yeah, your body's saying,
trying to figure out what it is.
Put rice pellets in my butt. So.
You know, somewhere there's some dumbass fucking putting rice pellets in something.
Yeah, because
I saw this in a movie once.
Yes, I saw this on YouTube, and it looked just like rice pellets.
Or just the shady aspect of it.
Oh,
So
yeah.
what type of testosterone do they use in these pellets?
Well, it's Thrifty Med Plus is where we get them from.
Mm-hmm.
And there's, now Dr. Berry can go ahead and tell you all the makeup and all.
Yeah, I didn't know if it was like an enanthate or an acetate or.
He is some kind of animal something.
Yeah.
I just watch his, my job is to watch your levels and put them in.
That's
and
right, yeah.
Up it and lower it. So, my good job is to get you to 1,300.
Holy shit.
Unless you want lower.
Well, no, I mean, I go.
What is it now? We were speaking about it earlier. In healthy levels, I'm 28. You know, what is healthy levels for someone between the ages? Like for him, like even though he was at 350, obviously that was not as healthy as he would like.
No.
What's healthy for a man at that age?
Well, I mean, when you were younger, everybody now that's over the age of, when you're 30, it's going to start dropping.
Right.
When you're 35, it starts dropping even more. When you're 40,
Yeah, it's almost non-existent, correct?
40 to 50, it's non-existent. So, that's when you need to start putting them in. Because that's when you start, you notice, like, when you get older, I mean, I always thought it was like a liver belly from beer, but it's not. It's from lack of testosterone.
Mm-hmm.
And they get that basketball.
Mm-hmm.
So when your testosterone gets up to about 1,500 or 1,200, that belly just shuts down.
And that's just healthy because your body's able to use what it's getting in instead of it not being able to keep up and it getting stagnant like that.
But the people that work out, we got people that take these for many reasons. We've got elderly people that in their 60s and 70s that take it for their joints and their knees. We've got people that want to lift weights and stuff. And the people that do the weightlifting, they do it for the stamina and the
recovery and things like that.
Oh yeah, when their joints don't hurt. You go in there and you lift all these big old heavy weights and your joints aren't killing you. So I mean, I guess if you use some sharp cartilage or whatever, and that's benzoin, that just makes all this stuff stick better. Here's a stereo strip that's just going to cover the hole. It takes about 72 hours for that little bitty hole right there. It doesn't need a stitch.
What is that, like a 2?
Yes, less than 2 millimeter. And then we'll just stick this on there just to cover it up. That's not touching his wound or anything. It's just to keep the water out. It's not sight. So everything comes off in 48 hours.
So at what point, like, should I be able to see in the dark? Like, when should that start?
All right. So So we're about 10 minutes out. We sat and talked with the lady that did the install, and totally cool. I feel a little bit of pressure, kind of like a little soreness maybe. Like when they were doing the install, didn't feel shit. Like you felt the first injection, felt the stuff going in, the numbing agent going in for the second and third injection. When she was putting, I guess the cannula or whatever it's called, the tube to inject the pellets, like I could feel them going in pressure, but there was no pain. Now that I'm sitting on it, it's still numbed. Like I don't know that I'm numb, but there's like a little bit of soreness. So I'm guessing it's going to be pretty fucking sore in a couple hours and tomorrow. No concern there.
Yeah, which is just the body getting used to the foreign objects in there, and then after that,
yeah, your body's trying to push it out. Like I'm sure I'll have a little bit of fucking probably fever from it, and the typical shit.
She said it'd be feverish like on the skin, but it shouldn't cause you to have fever. But
I'm sure I'll have a raised red area and some heat from it. There's a little steri strip over the incision or the puncture, and then there's a patch over that which should come off. It'll fall off in about 3 days, and that's just to keep that steri strip and the area clean and sealed. So no big deal. The whole procedure probably took 15 minutes start to finish, and heading back to the shop right now and just do normal rest of the day. So just more awesomeness of it.